Hi, good evening everybody. I am Dr. 𝐂𝐬𝐶𝐞𝐞𝐝, Specialist Internal Medicine at Pcr Hospital in Jumeirah. Welcome to all of you to this discussion on coronavirus. So, as all the media is now buzzing with this particular news about coronavirus, of course, everybody is enthusiastic to know more about this virus, what it's causing, what we are all up against as this epidemic is going on. So as we know, this started late in December 2019, and we have all been expecting an end to this epidemic, but it's still spreading from nation to nation. It started off in China, as we all know, in a province called Wuhan, and it became so much over there. The numbers were escalating day after day. The government did a lot of things to try to contain and prevent the spread of the virus, but unfortunately, the virus has been spreading. It's going from region to region, and it's also very much in the place where we are living. Fortunately, thanks to our efficient system in the Dubai Health Authority, we have been able to increase the awareness about this particular epidemic. We are also able to contain the virus to a much certain extent, and our numbers are not very alarming. So let's talk a little bit about this particular virus. So as we all know, it's called the coronavirus. So we're going to be more specific about this particular virus. As you know, coronaviruses, it's actually a group of human viruses. In fact, there are like 4 different kinds of coronaviruses. It's called the alpha, beta, gamma, and the delta viruses. The human variety is mostly limited to the alpha and beta varieties. And we have all heard in the past about the SARS and the MERS coronaviruses. So they did bring up a lot of scare during that time, and there was a lot of panic during that time. And it's the same situation that we are facing right now with the new coronavirus, which was called the novel coronavirus of 2019. So to make things easy, it has been renamed as COVID-19 virus, which is much easier to understand and even pronounce. So what are these coronaviruses actually? So they are residing in human beings, and many times we are also infected with coronaviruses, but not the dangerous ones. So the dangerous ones like the SARS, the MERS, and the COVID-19, it's interesting to note that they came from animals. So the current virus source is yet being investigated, although many have been implicated, in the current research and scenarios. But we are still not sure as the exact reservoir for these viruses. But one thing is obvious, it definitely came from the animals, and it passed down to the humans, and now humans are spreading it from person to person. So as this virus is spreading, I know there's a lot of panic, a lot of people are concerned. The schools are closing in the coming weeks. There's a lot of precautionary measures taken by the government. There's a lot of doubts in people's mind about travels, etc. And of course, it's we are also facing in the clinic a lot of patients concerned about this, and they are asking, can we get a corona test done? So let's answer some of these questions. So it's very important to understand, how do we diagnose a patient who is coming with a flu-like symptoms? So as you know, flu contains so many viruses. The disease we call flu is originally the influenza viruses. So we have the commonly ones known as the influenza A, influenza B, and also there are the rhinoviruses, adenoviruses, respiratory syncytial viruses. So generally, if a person has a flu, you don't have to panic that it's a coronavirus. But you need to come to the hospital, you need to meet a doctor, you need to get it checked up. So there are a few criteria that has been laid out by WHO and even by our Dubai Health Authority in order to identify those cases who are eligible to be tested. So some of the very important factor in this particular testing, one is patient should have symptoms. So patient should have upper respiratory, lower respiratory symptoms with or without fever. And there should be a positive travel history to the current infected areas. So initially it was China, but now we know it is spreading. A very common area now is considered to be Iran. Also some Southeast Asian countries like Indonesia, Singapore, Thailand, and Italy. So, and the numbers are increasing day by day. So a travel history is very important, or the patient should have come into contact with a person who has had suspected or a confirmed case of the COVID-19 infection. Then the criteria is there to test the patient. The other scenario is when a patient presents with severe acute respiratory infection. That means he has high fever, he has trouble breathing, he has a lot of clinical signs on his chest, and the x-ray is showing a lot of infiltrates representing severe acute respiratory syndrome. Irrespective of any travel history, he is eligible for the testing for the COVID-19 viruses. So what are the kinds of tests that we are doing? Currently, the test available is called the PCR test, called the polymerase chain reaction test, specifically for the COVID-19 virus. In Dubai, it's being done in Latifa Hospital, so that's where the samples are being sent. In Latifa Hospital, it takes about 12 to 24 hours for the results to come through. And we are usually using a specific media called the viral transport media, which is like a small test tube, and there are some swabs that we insert into them. So we take a good swab from the nose, from the throat, and if the patient has significant amounts of sputum, even the sputum sample is very essential to make a positive diagnosis. So these samples are sent to the laboratory through special containers, and as the patient comes in to any facility, as you know, first thing we need to do is the patient should be wearing a mask, and he should be kept in an isolation room, preferably away from other patients, other staff members, and these tests should be done. And if it's a strongly suspected case, or if it's patient is progressing towards severe respiratory distress, then we need to transfer the patient to a hospital. At any point, if any of you have doubts, you can contact Dubai Health Authority. They have a hotline which can at any point answer all your queries, or even the infection control in charge of your local clinic or the hospital will be able to assist. Everybody is in ready alert, everybody is looking forward to contain this virus. And most importantly, I want to say about personal protection, that is by taking care of your hands. This virus is notorious that it prefers to be transmitted through touch even more than droplet infections. So wearing a mask might help you to a certain extent. The surgical mask is not very protective. The N95 mask is protective, but that's restricted predominantly to healthcare workers, and especially if they are in the presence of an infected patient. But throughout the day, wearing this mask is not a very practical thing. So we need to take care to protect ourselves. So hand hygiene is the second most important aspect of containing this infection. So never touch your hands to your face, and that should be a practice. So that should become a habit for us. So avoid rubbing your eyes, avoid touching your nose, wiping your lips, keep your hands away. But if you need to touch, scratch, or do whatever on your face, make sure you wash it. So there are certain WHO guidelines on how to wash. So you need to wash a minimum of 20 seconds, sometimes even more. So make sure you wash all over, between the fingers, between the nails. So once you get a practice of it, it's not too hard, it becomes like second nature to you. Make sure you wash, wipe on a clean towel, and then you can touch your face, and then you are much in a safer position. So we need to understand how we can protect not only, but also we should understand how not to transmit, like even if you are sick, not to transmit it to other people. So if you are sick, make sure your employer is well aware of that fact that you are sick. You need to take off from work because it's going to rapidly spread in a working environment. Secondly, you need to protect yourself and you need to prevent it from spreading to other people. So do wear a surgical mask. That's a very simple thing, and that really makes a big difference, that if you cough or sneeze, you are not going to spread it to other people. And let's say you don't have a mask, then how are you going to cough? You need to use your elbow. So you need to sneeze, cough, etc. into your elbow. The other thing you can do is use a tissue, cough into the tissue and promptly dispose of the tissue. But avoid coughing publicly, coughing into your colleague's face, coughing into a stranger's face, etc. This one fact can actually prevent the spread, and we can easily control this virus if every person who's listening to me is going to take care. Make sure your supervisors are aware if you are sick, and there is no specific detrimental things that's going to happen in case you need to be off. And importantly, you need to understand good nutrition is very important, and not to forget, you need to balance your work and rest. So the harder you work, you need to not waste time in the night. You need to be in bed early and get your body the rest that you need. This is one of the most important things that we have learned over the years, that patients who are not resting enough are very much prone for catching influenza, corona type of viral infections. And also mental stress is also part of it. And all those are detrimental to your immune system. So just make sure you, during the next couple of months, as we are going through this epidemic and we are trying our best to control this particular epidemic, we all need to take responsibility, we all need to take care. And really, I don't think it's as scary as some of the media will make you to believe, because majority of the patients are doing well in spite of being contracted the virus. And the complications are usually found in patients with immune problems. For example, the very old, the very young, those who have respiratory issues in the background, those who are on immunosuppressive medications, etc. So they need to take care, they need to really protect themselves. Also, if there are non-essential travels, you can definitely postpone those plans also. If there are non-essential meetings that can be postponed, even that will also help in containing the spread of the virus. So the my advice to the people who are listening to me is, let's not panic in this situation. You don't need to come running to a hospital to have a routine check. But if you are ever having strong flu-like symptoms, you have a fever, or at any point you have trouble breathing, do consult a doctor. Your doctor will be the best person, and he's going to give you a thorough examination of your throat, your chest, your ears, your nasal cavities, etc. And he will know to a certain extent whether you might be a carrier or you might be a person who could be potentially suffering from this COVID-19 viral infection. Yeah, at this point, I want to invite my colleague Kimia to participate, and let's see. She has some questions and that people have been sending her, and let's see what she has the questions in store for us.
Thank you, Doctor, for joining us for this session. We have a couple of questions coming in from our listeners. One of the questions is, so it is suggested that you wash your hands and then you use a sanitizer. How important is a sanitizer, using a sanitizer?
It's a good question. So how often do we have access to soap and water? I don't think a person who's walking around outdoors, he has any access. Sometimes you may be in a place, in an office, and you may not find a washroom that's easily available. So at this is the condition where a sanitizer will be very helpful, especially if parents do have children. It's a big task to make the kids to go and wash hands. So the best option is to have a sanitizer, and it's been very much recommended that sanitizer is definitely effective in getting rid of the COVID-19 virus, including all influenzas, other coronaviruses, rhinoviruses. Yeah.
Okay.
So those tiny little bottles that you have, you can carry it with you at all points. Just put a couple of drops into your palm, rub it carefully. Just make sure you cover all the parts of your hand and just let it to air dry.
Okay. And how often can we use a sanitizer? How many times in a day?
In fact, as we touch all surfaces, that means you are, after you sanitize your hands, you are bringing an infection back onto your hands. So before you are involved in any activity, let's say before you touch your face, before, for example, before we touch a patient, after we touch a patient, and before we are doing any procedures, definitely this is when we need to sanitize our hands. And of course, in case don't have access to water and you need to eat something like a sandwich or something,
Then
you can sanitize your hands.
Also, you had mentioned about how coronavirus is a virus and, one kind of a flu. Does a flu shot help people protect themselves from this condition?
So influenza injections are specifically designed to combat influenza viruses. Unfortunately, they don't protect you from coronavirus infections, but from a practical perspective, we've seen patients who have taken the flu injections generally tend to have a better immune response.
Okay.
And even when they have non-influenza viral infections, we see that their duration and the intensity of their illness is much shorter than those who have not taken the virus, the vaccination.
Okay. And are there any certain kind of foods that one can eat in order to build their immunity against this virus?
That's true. There are no specific food items that you can eat in order to protect yourself, although we see very much on social media use of garlic, use of turmeric, etc. can apparently protect you from this virus, but none of them have been studied or been proven. But it's important to have a balanced diet. So just make sure you have the right amount of proteins, you get the right amount of vitamins, and those things will help ultimately to boost your immune system.
Okay. People in general, do you recommend people to stay indoors more often as of now, since the virus is where it is, or that should not matter?
So it really doesn't matter, but it does matter where you are. So more crowded areas, especially places where there are more tourist people. So we are looking at like malls, train stations, metro stations, public transports, convention centers where you have a whole lot of tourists coming in. So you need to take care of yourself. But generally outdoor, if you are in a park, your chances of catching it from somebody far away It's
Okay.
much less, and of course the environment is hot outside, so
Okay.
these viruses don't survive in humid hot temperatures, but they do survive significantly long amount of time in air conditioned environments.
Okay. So does this mean as the temperature rises, the chances of this virus going down are high?
There is a high possibility of, but of course in our country almost we have a constant temperature indoors. And speaking of indoors, probably the recent decision by the government to close the schools on the coming week. So that will at least ensure children are indoors. They are at home in nice, clean, safe environment. So transmission between the children and ultimately, that's where it reaches the homes.
Okay.
So at least that part will be much controlled if it's an indoor. But otherwise, there are no restrictions on outdoor activities. So you can go out and enjoy.
Okay. We've been hearing a lot about in the news about quarantine. If you can explain what does that mean for a person, what does that mean and how important it is?
With the current understanding about coronavirus, there is total duration which has been calculated as 14 days where the virus can be infectious, can be transmitted. So we are looking at a quarantine of 14 days when a person is infected, so that he will be non-infectious by the time he's out in the community. So patients who are healthy and who are stable, they can stay at home and quarantine themselves and keep a watch on their symptoms. Patients who are sick and who are admitted in the hospital, we do have specific isolation rooms which have negative pressure ventilations. So they will be quarantined in those specific rooms again until they are fit to go home, and even after they go home, we are looking at a total 14 days or even slightly longer according to how bad the case was.
Okay. You mentioned about children, the kids being at a higher risk. Is there a specific reason for that?
Actually the current research has shown that children have not been as sick like the adults, but like I had mentioned the first time, the extremes of age are important. So very young children and the very old are at the highest risk. But children generally have been doing well with the coronaviruses, and we haven't heard of any adverse mortality, especially among children. But they could be a potential carrier, which is why the schools are preventatively being closed in the coming weeks. But they can be a potential carrier. They might share it. They might take it home. So that's where it really matters. But overall, kids seem to be doing well. So I think parents who have kids, they don't need to be too much worried.
Okay. What about the masks that you just mentioned? Do you recommend any mask as such for everybody to wear when they step out in a crowded area?
Yes. The surgical mask really doesn't protect you from viral infections, especially because the particle size is very small. They're like less than 0.3 microns. So they might easily pass through the mask, and also the areas around the mask will be also exposed to the entry of the virus. But like I had mentioned earlier, it's very important that a sick person should be wearing the mask because he will prevent transmission of the virus. But where the surgical mask does help is once you're putting it on, you will avoid touching your face.
Okay.
Yeah, so that makes you very much aware that you don't have to, you shouldn't be touching your face. So I think in that perspective, it really helps.
Okay. And how often you should be changing your masks?
So surgical mask typically lasts about 8 hours.
Okay.
Yeah, after that it really loses its flexibility, the porosity, etc. all changes. And the exterior, if you are in a crowded environment, might be contaminated with the virus. So putting it in your pocket, it's a bad idea.
Okay. So
yeah, so you need to throw it in a specific enclosed container and not to be exposed to public.
Okay. And how long does these virus stay on different surfaces, like clothes, metal surfaces, or ceramic surfaces?
There have not been specific studies regarding the COVID-19 virus, but they have done a lot of research on the past coronaviruses which have been around. So in a closed environment with air conditioning, it can last anywhere between 4 to 5 days, and even on metal surfaces, sometimes even up to a week. Much lesser on clothes, maybe 3 to 4 days. But but we have to just take all the necessary precautions, because this is still a very new virus and we still don't know a lot about it.
And one of the last questions, if there's an outbreak in the area, what can a person do to prevent that to reach them?
Okay, I think if there's an outbreak that has been declared in your particular area, definitely stay at home, which is the safest place for people. Avoid going to crowded places like malls, shopping centers, and I think it will be a good idea to wear a mask, especially like I said, you'll be holding shopping trolleys. So those could be infected, door handles, lift buttons. Okay, so to protect yourself, I think we all have a bad habit of touching our face, scratching ourselves. So I don't think we can stop it. I mean, for me, after years of working in this room, I'm careful not to touch my face, but I think it's common for people to be touching their face. So in that perspective, wearing a mask is definitely helpful. So, but if it's in your area, stay indoors and keep up to date about the news releases. You can all go through DHA websites. They are regularly updating the latest about the coronavirus and what their recommendations are. So, and there is, like I said, there's a hotline. If you have any questions, health professionals, if they have any questions, they can also contact them. They are quite helpful.
Okay. And the last question, are there any differences between the symptoms that a child shows and an adult shows?
The symptoms are the same. So it's a common flu-like illness. It starts. But those with immune compromised conditions, generally we see it directly goes down into the chest. It almost like bypasses your nose and throat, and they kind of decompensate quite fast. So we find them with a lot of shortness of breath, coughing, low oxygen saturation, and X-rays which are like very diagnostic for severe acute respiratory infections. So I think children have been doing well, so I think we don't have to be as scared at this stage. Let's wait and watch. And let's see how things progress. We should also thank our government for taking all the necessary steps to contain this virus. And thank you all, and all the best, and stay safe, all of you. Thank you.
Thank you, Doctor, for joining us.